As part of the evaluation of a patient with hematochezia, it is important to figure out if the bleeding episode is a severe bleed or not. How do you go about doing that? If the patient says or the family member says that the patient had a syncopal episode after having had a bowel movement and coming out of the restroom, he had a dizzy spell or had a syncope, you should consider that the patient has had a massive bleed with at least 500 to 1000 ml of blood loss. You should also consider the possibility of a severe bleed if the patient is having any mental status changes or having worsening of his comorbidities, worsening of his heart condition, like a development of an angina, or worsening of his heart failure, or worsening of his kidney failure. You should consider that the bleed is a severe bleed with end organ dysfunction. You should also consider that it is a severe bleed by looking at his vital signs. In this patient, you notice that the heart rate is 120 beats per minute, and anytime a patient has a tachycardia with a heart rate above 100 beats per minute, you should worry about volume loss, a significant amount of volume loss, and that indicates a severe bleed. In addition to looking at the heart rate, you also look at the blood pressure. In this patient, the blood pressure is 90 by 60, and any patient with hypertension and a systolic blood pressure of less than 100 millimeters mercury, you should consider significant loss of volume. Otherwise, it is a severe bleeding episode. A simple trick is look at the heart rate, and if it is above 100, look at the blood pressure if it is below 100. Then look at the ratio between the heart rate and the blood pressure. If it is more than 1, you worry that there was a significant amount of blood volume loss. Otherwise, it is a severe bleed, and you should be prepared to manage that patient with wide bore IV lines and preparing to resuscitate him. If the patient is continuing to bleed, the patient is admitted to the hospital, says that he had a bleed in the morning, and then had multiple bowel movements, all of them showing blood. And while you're uh, resuscitating, he continues to have ongoing bleed. That is again an indicator of severe bleeding. How about the blood work? If the patient had lost significant amount of blood, usually the hematocrit and other parameters may not change immediately, but if the hematocrit is less than 35%, or if the serum creatinine has gone up to above 1.5 milligrams per deciliter, you should worry that there is significant volume loss. In other words, you're dealing with a severe bleed. In summary, if the patient has a syncopal episode or altered mentation, worsening of comorbid conditions, new onset of angina, worsening heart failure, worsening renal failure, or if the patient has a heart rate of above 100, a blood pressure, systolic blood pressure below 100, a crit of less than 35, a creatinine of more than 1.5. You should be prepared to manage that patient aggressively because that patient had lost significant amount of blood and is at high risk of having complications. I hope this is helpful. Thank you.